Woodruff here at Pure Plastic Surgery. Was out last week. I was on vacation, went to Paris, had a great time, first time there. But we're back in action this week, and today I had a case where we used GalaFLEX mesh, or as some people think of it or hear about it as the internal bra that we can use for breast surgery. So I want to talk a little bit about GalaFLEX mesh, what it is, what we use it for, and who really needs it. So first of all, what is it? So there's a lot of talk about mesh in the media, and sometimes you hear lawyers talking about it for GYN procedures and different things. Most of those meshes that cause issues are permanent meshes, meaning they don't go away. So if they get infected or have an issue, it really becomes a problem. This is not that. So just to start with, it's totally different than those types of meshes. This is similar to an absorbable suture that we use. It just absorbs over time. So it's PHB4, which is a biologically derived substance that our body absorbs over time. And so this turns into a two-dimensional or three-dimensional mesh that we use for tissue support. And so what that does is whenever we do surgery or we make an incision, that scar heals to about 80% of its strength, its original strength of your skin. And so what this substance does is it helps create strength to reinforce things. Particularly for breast surgery, it helps reinforce either the implants or the breast tissue itself to hold them up into place to keep them from bottoming out or drooping. And then over time, as your body absorbs this material, it's replaced with collagen, and it's actually stronger than your native tissue. That's where the internal bra component of this comes from. And so it's a great tool to use for select patients. Who needs it? It's a little unclear who needs it if it's a first time surgery. The patients that probably would benefit from it are weight loss patients or patients that have really poor skin quality, meaning you have a lot of stretch marks or your skin's just very thin. Then you're likely to have, or it's possible to have, problems with the weight of implants causing drooping to happen faster than we would like it to. So for those patients, I may recommend it for their primary surgery, but typically I use this for revision surgeries for patients that have previously had surgery and then had an issue, and this is trying to help correct those issues. So for my case today, it was a revision case for bottoming out where the implants were placed, and we did an augmentation with a breast lift at the same time. Everything looked great. Then a few months later, all the tissue started drooping a little bit. And that's why I recommended using the GalaFLEX mesh to help reinforce those implants for the revision to help hold them into place. And it's really been a super beneficial material and tool to use for doing this. Previously, some of the only other tools that we had for reinforcing stuff was cadaveric tissue that was super expensive, and it was a decellularized material that we still use for breast reconstructions and different things, but again, it's kind of prohibitively expensive for cosmetic surgery. GalaFLEX mesh is not cheap, but it's much cheaper than some of the other options we have. So with all that being said, do we have any questions about GalaFLEX mesh or anything about plastic surgery in general?
Okay, let's start. There's a question on TikTok. How do you stop keloids? All my surgery scars have keloid, but I want a mommy makeover.
So that's a tough problem for someone that's really prone to having keloids and you've had multiple surgeries where that's happened before. It's likely you will have keloiding again. What are the things we can do to help prevent or decrease the amount that the keloiding happens is, one, just by the surgical technique, doing limited tension on our incisions when we close them. Second of all is during the recovery phase, as everything's healing, using either silicone tape or silicone gel that we have here at the office called Silogen. It acts as a barrier and it helps keep the scars from becoming raised, but that's not 100% guarantee that it won't prevent a keloid. Second thing is if the keloid starts developing, we can do things like injecting a steroid into it, Kenalog, or a chemotherapeutic agent called 5-FU. We can also inject into it to help decrease the amount of the keloiding. The very worst case scenarios for certain patients, they can even get radiation if they got really bad keloids, but that needs to be arranged and that's kind of difficult to do. So for someone that's considering getting a large surgery like a mommy makeover, where you do have a lot of incisions and a lot of scars, and you have bad keloiding, something you're going to really need to think about if that trade-off is worth it for you. The final thing we can do to treat them is if you see a cosmetic dermatologist or someone like that, there's different laser treatments for keloids.
Okay, Doug, how long are the incisions under the breast for a breast lift? Or does it vary by case?
Yes, it does vary by case. So typically for an incision underneath or for a traditional Weiss pattern breast lift, it's a vertical scar and then down along the whole fold of the breast. But some women have breast tissue that extends beyond the borders of the breast and goes further back. And to improve the contour and to get rid of some of that lateral side boob or roll, we may need to extend that incision further. Other people, they can get mostly a vertical incision with just a small component of the horizontal incision underneath the fold of the breast. And that depends on how much we're lifting or reducing the breast.
Okay, well, many questions. I had a breast augmentation with Leaf and GalaFLEX, and I can feel the edges of mesh along my breast. Is that normal?
That can happen, and that's definitely something I talk about with patients, but the really important thing for the surgeon as you're placing the mesh is to make sure there's no folds in the mesh, because if there's any folds in the mesh, that's where you can have problems like feeling it a little more prominently, or sometimes you can develop a seroma if there's a bad fold or bunching of the mesh, so that's why you have to take a lot of time to make sure it's laid out nice and smoothly. That being said, that may not be the problem. The good news is your body does absorb this over time, so that whatever you're feeling is going to get replaced by your own tissue and become softer, so it should go away with time.
Okay, it's not a question, just say your work is incredible. Thank you.
Awesome, thank you so much.
Okay, one more question, Doc. Should I be worried to come back to exercise after surgery? I lift heavy weights and I'm concerned to lose my power after that.
No, so basically most of our surgeries you can get back to your 100% normal lifting routine. There's maybe one exception in there, but you will be able to get back to lifting heavy weights no matter what we do, even if it's a tummy tuck with a muscle repair. You do need to give it time to heal properly. You need to give your body time to really scar that repair into place so that you're not undoing any of the work we do. The one exception to that is for patients who receive breast implants underneath the muscle, underneath your pectoralis muscle. You can still work out and do pretty much everything, but if you lift very heavy, focused exercises on your pectoralis, like push-ups or bench press or burpees, those can cause the implants to squeeze out quicker than they otherwise would and can lead to some problems, again, with implant malposition. So those are the only times I recommend patients maybe take it easy on those exercises, but we do have other options for you. We can place the implants above the muscle and underneath the fascia. All right, everybody, I hope you enjoyed. Have a great weekend coming up, and I'll see you next week.
Boom, boom, and cut.